Well, South Africa has averaged 137 new COVID-19 cases over the last week, and an expert believes the lockdown is succeeding in flattening the infection curve, but it's still early days. Michael Appel takes a look.
We didn't get the anticipated, my fellow South Africans. Instead,
compatriots, it is 25 days since South Africa began a nationwide lockdown.
With this in mind, let's look how we're doing. Confirmed infections stand at over 3,400 now, with almost 127,000 tests conducted. But this health actuary says it's just the tip of the iceberg.
I mean, the number of confirmed cases is rising, partly because our testing capacity has increased substantially. The trend in number of tests done has been good news. But the overall sort of infection rate that we think is going on underneath that, the sort of the bit of the iceberg that's underwater, is in line with what we would expect in a lockdown situation.
Over the last week, there's been a daily average increase of 137 cases. The biggest jump yet was 251 cases in a single day on 18 April. This week's total increase was 959.
The nationwide lockdown has been implemented with the express aim of flattening the curve. Has it been able to do that, or is it simply too early to tell at the moment?
No, I think we can absolutely say that it has had an effect in flattening the curve. We are, if you look at the sort of numbers of hospitalizations, if you look at the number of deaths, all of those data points are coming in under what we would have expected to see in a non-lockdown situation.
Ranchod says that having gone into lockdown quite early, our fatality rate has remained comparatively low. But there are other factors, including a large immunocompromised population, to consider.
We still don't know whether the positive effects of us having a younger population, because we know that the mortality rate is very strongly related to age. So our overall population structure is much younger than somewhere like Italy, for example. But there are offsetting factors in terms of our burden of disease.
The president may announce some significant lockdown changes when he addresses the nation on Thursday. As a potential spoiler alert, chairperson of the Ministerial Advisory Committee on COVID-19, Professor Salim Abdul Karim, recently said we need a daily increase of 44 cases or less in order to ease the lockdown. Our current daily increase is far from that. Michael Appel, Johannesburg.